Peter is my name. I work with Savannah Informatics Limited. It's a technological company that works in consortium with the University of Nairobi and Fahari Jamii, which is a USAID project that supports HIV services in Nairobi and Kajiado. Okay, and so that's why I'll be presenting this abstract that of the work that we've been doing there that concerns the lab. And mostly it's about clinical lab interface. As the chairman of the Kenya Medical and Laboratory Technologists mentioned today, he really emphasized on laboratory technologists being team players with other health providers, that you're not working in isolation. And now that brings what we're trying to do in Nairobi and Kajiado. So we're trying to bring in the kind of work that you're doing and see how it can be consumed immediately by the users, who are most likely the clinicians, and they can be able to use the results real time. Yeah, so in health, we know when it comes to making decisions, time is of essence. And, anything can happen if you delay when you're giving out your results. As the chairman said this morning, you're dealing with a human being. It's possible that what you're doing with that result in terms of either delaying or giving the results on time will impact on the life of that patient. That patient may be a breadwinner, maybe the mother of a child somewhere who could be breastfeeding, and there are many other lives that depend on that life. Yeah, so with that, we know that in this world, that happens everywhere. We are not just limited to HIV medicine, it's also in any other kind of aspect of health. And so that's what I want us to deep in or delve into and look at it in details. So what we did in Kajiado, Nairobi, for the facilities that we support, 152, and they're slowly growing with the work that we're doing there. The county is seeing that we're doing more, and they also want the same impact being felt in the other facilities that initially were not supposed to be in our cohort, like the facilities that we're supporting. They are slowly growing. We started with around 125, now we are at 152, and slowly we are going to 160, I think around 166. So what we did, we were trying to see, Kajiado is very vast in terms of area, and say a test has been done in Oletepes, and results need to go to the testing lab, because could be the facility does not have the capacity to run the test. Then the result will come back to the facility where they will be used. That takes a lot of time. It really takes a lot of time. And so this is what we are trying to work on, like reduce turnaround time. And as we were working on that, we also realized that there are other benefits that this app brings. And we realized that now our patients are able to get, treatment at the right time. And we are also able to even employ other advanced analytics. So this is how we did it. As I said, my slides are very few, so you can just be focused. So this is how we did it. The implementation happened between last year, October, and by the time we were writing this abstract was in the month of June, but still we are still implementing this initiative. So as I said, the number of facilities are 152. So the key features is that the moment, maybe I can just show this first. So the moment a clinician do the consultation, what usually happens is they send the patient to the lab where bleeding happens. In our counties, we have a transport system which takes the samples from wherever they are, because facilities are so far from each other. And it's not all of those facilities that have the capacity to run these tests. So it's taken to the testing lab. So after it's done, the results are then taken by the rider, who takes back the sample, or the result, to the refiling laboratory. And then the refiling laboratory, after entering this into the CD4 tracking log, then gives back the results to the clinician. So this is the journey that our samples take through. And as we are saying, the rider does not go there every day. So the rider, what has been happening is they go there every 2 days, sometimes 3. So you can imagine now what happens here, okay? Because it's when they take the sample that they will take the result back. And it will depend also with the lab person on how fast they are going to enter the results into the CD4 tracking log, so that they can be able to provide the clinicians with the results. And I believe it's possible. This is what happens also in your facilities. So what we've done is that we have realized there's a lag here. We were trying to optimize this process here, because before, it was not structured on how the rider was doing it, and so we purposed that it will be done every 2 days. So we realized that has been optimized, but the turnaround time for this has not changed. So what did we do? We have now developed a Labpulse. So Professor, this morning, I saw that they have a QPass, but now for us we have Labpulse. Because we also wanted to feel what is laboratory doing in terms of managing patients with advanced HIV disease. So we developed this, and this is now able to help the clinician log in and see what the testing laboratories are doing. This is not something that we have around, and it has really helped us in terms of now managing our patients. And as we said, time is of essence. So going back, so this is what we've done. So it gives you real-time access to the results, wherever they are, whether they were taken to the testing laboratory, and then they realize they don't have reagents. Either the samples were moved to another facility, or there were reagents that were borrowed now from other facilities and were brought to the refiling laboratory. So that doesn't matter, provided the samples are there and the results are done, we're able to see this. Also, we've added other tests that are reflex tests, and that includes the CRAG results, also the lateral flow, TB-LAM, so which are supposed to be done after the CD4s are less than 200. So, and in the platform, what we've done is that we've put validations such that if the testing lab is putting in results and the results are not there when the CD4 is less than 200, there is a flag for the laboratory technician to say why that was not done, so that there's no assumption of I did this and all, it was not done because of other reasons. So this has really helped us. And when we introduced this to the county management of Nairobi and Kajiado, they really embraced it. And so what we also realized is that they are also part of this. They are logging in, they want to see how results are being learned. They can be able to see which laboratories in terms of workload. When we now employed the other advanced HIV analytics, advanced data analytics, we can be able to see the workloads per testing facility. They can be able to see the positivity, the rejection rate. They can be able to see turnaround time for any facility. They can be able to filter and see all that. So So what were our key findings? So what we realized is that our mid-around time really changed. And this may not look like much, but I'm telling you this means a lot to a HIV patient who has a CD4 of 2 and has both TB LAM positive and CRAG positive and need to be started on treatment. And sometimes in those far-flung facilities, we realize that samples could take the turnaround time, say, 30 days, some even 40, depending on how, well the CD4 tracking log was filled. Yeah? But now when you look at the mean for all facilities, and obviously, mean is not the best way to look at it. It's, it has its own limitations. But when you looked at it before, it was there around 7 days. Fine, because of the Nairobi facilities, which are more. But in Kajiado, obviously, it was a bit far. And we had outliers, as I said. So this has really changed. Right now, we are doing 5 days. So a patient, that was in the month of June. By August, we were doing 5 days. And September, as I checked the platform, it's around 4 days. So this has really impacted on the way we are doing stuff, and we are really happy about it. So this is our plan, like what next? We're trying to see how we can be able to expand the leash of now Labpulse. I know we don't have platforms where we can be able to track CD4's samples, how they're being done from wherever they're being done, and how long they are taking. If you are told could be to go and calculate the turnaround time for your facility, or could be your sub-county, or even your county. I don't know how long that will take you, because someone will need to sit down and look at all those CD4 tracking logs and come up with data. Whether true or false, you'll not know. But this is real time. The date stamps are usually picked by the system. So we're also trying to see whether we can be able to optimize this with the evolving needs. And we are ready to work with anyone at any one time and see how this can bring the change that we all want. So there's sure an improved turnaround time. And what we've seen for like the patients that had have had advanced HIV disease, their positivity was around 4.2. And you can imagine now these 123 patients who had their samples positive could be a long time before they were started on treatment. Out of 2,817 that had a CD4 less than 200, okay, and TB LAM of 15%. So this is really impactful, and we are really urging us to, could be, you can consider reaching out to us, and we see how we can do this. So I want to thank you for your time, and if you have any questions, we'll be able to answer. Thank you very much.